Mastitis level is running about 20% in the whole herd. That's higher than I would like. We normally run about 15%, 12, 15%. We had a bit of an outbreak of mastitis in July and August this year when it was very hot. I think it was just sort of flies and cows outside huddling together. It was difficult to manage, so it was very much a tail end of lactation mastitis outbreak we had. I'm a great believer in cows' immune system. It does take a lot of energy. I think it's a cell count response to cows with mastitis requires 1.2 kilos of glucose to produce the white blood cells which go out and respond to that mastitis infection. So to me that really ties in with just keeping the cows eating. If you can keep that energy intake going into them, their immune system will kick in and cope with most problems, is the way I look at it. You know, since we've been treating cows who come up with a health alert, we've been getting a lot less mastitis. Can't necessarily say the two are linked, but if you can keep the cow's immune system and she doesn't actually develop a clinical mastitis, great. And a lot of cows that do get an E. coli mastitis don't ever develop into anything clinical, do they? But if we get beyond that and a cow has got a hard core or clots, my instinct is to treat the thing as soon as possible with both anti-inflammatory and antibiotic. So I'm not for waiting around. Our approach was to avoid treating as much as possible, but when we do treat, we go in with mamazine, which is a real big heavy dose of penicillin, and we find it works really well. We get a very, very, very low recurring rate, so if we do treat, we make sure that we absolutely finish the course and we go for a big heavy course which will cure the problem. But if you don't finish the course of treatment, you are selecting for bacteria which are then resistant to the treatment which you prefer to use. So last year we used antibiotic treatment on 40 out of the 220 odd cows that we dried off, so it does work. There are cows that have got an infection when you dry them off, and antibiotics are the best treatment to kill that infection. There's no doubt about it. You shouldn't not use them, but with a cow that's consistently had a cell count below 200 for oral lactation, you should definitely not use it. And having said that, we use teat sealants on all cows. Teat sealant without an antibiotic is a risk. If you get it wrong, you can introduce that bacteria, so you do need to be very careful and meticulous about how you do it. It works really well for us.